studios of Adabated by 9 FM. Good morning and welcome on to this edition of Aketi is Working. My name is Dimeji Daniels, and today on the program we will be talking Lassa fever. What the state government is doing to control it and to ensure that people become enlightened about this scourge. I'm being joined on the program today by the state epidemologist, Dr. Fagbemi. You're welcome on the program, sir.
Good morning, and thank you for having me.
Also with me in the studio as well, the assistant state epidemiologist, that is Dr. Dolani Belila. You're welcome, sir.
Thank you very much, sir.
And of course, the Director of Pollution Control and Sanitation in Ondo State, Mr. Oladipo Obanoye. You're welcome on the program.
Thank you, sir.
Let me start from Dr. Fagbemi. There is a program that you are starting tomorrow, that you're launching in Ondo State, and I hear it has to do with rat. What is it all about, and why is the Ministry of Health doing this?
Ondo State has been having repeated challenges with Lassa fever. Unfortunately, even as at now, we have almost become the state with the highest burden of Lassa fever. And we've tried various things, and we've come to realize that one major area that we need to pay attention to is the issue of the primary infection itself through the rat. The rats are the main cause of the problem. This virus actually transmitted from rat to man, And so this time around, this year, we are really focusing against on the rats. It's Operation War Against Rats.
That's what the program is called?
Yes, okay. War Against Rats.
War Against Rats.
Dealing with the rats everywhere.
Okay. For people, let me quickly tell you, if you have any questions in the course of the program, we open the port for you to call in and ask any questions you have about Lassa fever. What you need to do to ensure that you're not infected, how you need to keep your home clean and all of that. Dr. Fagbemi and his colleagues on the program will be answering all your questions. Now, how do you intend to go about this war on rats?
We are going to go about it in a comprehensive manner and as well as in a systematic manner. Fortunately, we know the local governments where the Lassa fever is endemic, and we know that the rats are interfacing with us in our homes. So what we intend to do is the state is distributing rodenticides.
Okay.
Drugs or whatever that we can use to kill the rats. We'll be giving it to the public, people in the communities, everywhere. They'll be distributed to them. They'll tell them how to use it in a very safe manner. And we know it's tested, the strategy is tested in other places. Other people have done it, other states have done it. So we are going to do it. And as the rats die, we're going to collect the rats. We'll tell them how to do it safely. In fact, we're even buying the rats. We are buying the dead rats.
From the people?
From the people.
You pay them for it?
We pay them for it.
That's serious.
We pay that. Everybody will be motivated. We're getting the rats out of our environment. And of course, backed up with also making sure that the issue of environmental sanitation also, because actually it's the waste that brings the rats to our house. Waste and food, not just waste. If you leave your food lying around too, the rats will come calling. So we'll be talking to the people on how to make sure that they manage the waste better, they keep their food safe, and they make sure that their houses are also as much as possible rat proof. Block the holes, all the places. It's a tall order, but I mean it's going to be a real battle this time around, and we intend to win.
Okay, let me turn to Dr. Belila, the assistant state epidemiologist. Now, a lot of people have wondered why Ondo State seems to be affected this way. What do you think is responsible for the rate of infection, this high rate of infection in Ondo State? Does it have to do with the attitude of the people to sanitation matters, or is this something that is natural?
Let me start by saying that there is no way we talk about Lassa fever and we will not talk about attitudinal change. The attitude of our people generally vis-a-vis the environmental sanitation, personal hygiene, And the community hygiene is very, very important. Just like the state epidemiologist has said, the primary source of infection is the rat. And what attracts the rats to man is the environmental condition. If the environment is clean, if the food are not there for the rats to eat, if you keep personal hygiene at home, the rate will be drastically reduced. And definitely we will also talk about what we call the health-seeking behavior of our people.
Okay.
Because by the time an individual is inadvertently infected, and the next thing you do is you approached a patent pharmacy shop
without going to the hospital.
Treat yourself. To you, it's a malaria, and without getting to the hospital. And as at the time you get to the hospital, the situation, the complication has already set in. So such an individual surviving it, the risk will be very reduced. So we talk about the community hygiene, the personal hygiene, and the health-seeking behavior of our people.
I read a particular interview by Dr. Fagbemi. I think that was to Premium Times in March, where you said what he just mentioned, lateness to not coming to the hospital on time. Now, let me ask Dr. Bilila, for people who are listening, who have not been infected, who have not had any experience with lassa, as an expert in this field, what would you say are the symptoms to look out for?
Thank you very much.
Because sometimes I think there could be similar symptoms. Some people have said in a way it could look like Ebola, it could look maybe like COVID-19 as well.
Yes, let me start by saying that as an health care worker, we are not only experts in it. Some of us are also what I would call lassa fever survivor.
Oh, that's serious.
We experienced it. And that is why I made reference to health-seeking behavior. If you are the type that does not embark on self-treatment, if you report to the hospital early, and the very high index of suspicion, like we've gone around virtually all the hospitals and we have another phase of going around again, what they should look for, that is what the patient will present with. It could mimic even the malaria itself at the beginning. It is toward the latter end that you now start having extreme weakness and bleeding starts coming in.
And at that point, is there any hope?
At that point, the complication is already there.
No hope again.
The hope is still there, but the hope is much reduced, so to say. So by the time you're having fever, you're having malaise, that's the general weakness of the body, and the fatigue starts setting in. Some will present with headache. Some can say they have sore throat. You see, it mimics malaria and even COVID in a way.
Because a sore throat, for instance, you have that if you have COVID.
Which is likelihood. So by the time an individual gets to the hospital, further questions to be asked by the doctors and the nurses will now raise what we call the index of suspicion. And if such an individual will catch the person early, you isolate the person early and the treatment starts early. In essence, you have protected the contact. You reduce the number of contacts that such an individual can have, and you have also protected the community. Because if you don't get it early and that person gets back to the community, that person is not isolated, there's going to be a higher risk of individual contracting lassa in that community. And if it is caught early, you isolate and you start the treatment early, the rate of survival of such an individual is very, very high.
Let's say 1 to 100, what would you say is the rate of survival?
1 to 100.
Yeah.
If the person presents early, it's almost 90-95.
Oh, good.
But by the time such an individual presents late with complications, the survival
the chances go down.
It goes down drastically. Drastically.
If I hear you correctly, what you're saying to the people is that any kind of symptoms you have that look, sometimes it could look like malaria, go to the hospital, don't do self-medication. That is what you're saying.
That is the message.
Now, beyond keeping your environment clean, for instance, in the case of COVID, you will tell people wear your face mask, don't shake hands with people. There are safety protocols for lassa fever. What safety protocols are there?
Let me start by
especially to prevent person-to-person transmission, because I know that is also an issue.
Yes, to prevent person-to-person transmission. Let's start by saying that we first protect the first person from having it in the first place, which has to do with personal hygiene. And also, like the state epidemiologists have said, you keep your home rat-proof. Your food must be in a rat-proof container. You don't just expose your food at home, because by the time this rat get in there, leave their feces, their excreta, their saliva, even on surfaces, individual can contract it through that source.
The kitchen counter, the kitchen cabinet.
And you touch your mucosal surfaces, just like lassa, just like COVID. You can get it through that. So if
I touch, for instance, and then I scratch my eyes or my nose,
you can
with that,
get the virus from there. So that is why we also talk more on hand hygiene, which is your hand washing, just like we talk about it in the case of COVID. So they have some similar protective measures, COVID and lassa, but we continue to say it. This personal hygiene is important. Your regular hand washing is very, very critical and important, and the use of hand sanitizer is also very, very important. You must keep your home safe from the rats.
But unlike COVID, it cannot be transmitted through the air, through the atmosphere, like COVID, where you have to wear face mask. I'm just asking.
Yeah, we will not want to say yes, because when we have the urine of the rats on the floor or on something that could be aerosolized,
maybe like dust,
it has also been documented that such an individual can get it through that source.
Oh, that's serious. Okay, let me turn to Mr. Obanoye. Now, I know the state government cannot do everything, and even there's a limit to what individuals can do at their own level. They can keep the environment, but people have waste that they have to dispose. And in some communities, because I remember there is a time, from your name, I think you're from Obanoye, am I right? Yes. Okay, so that means I'm correct. There was a time that I sent a report out to Owo. There's a particular community in Nowo where they have this dunghill, where at some point they even said someone came there and dumped the dead body of a baby, of a toddler there, and nobody was responsible, and it became an issue in the community. They caught the attention of the local government, and for weeks nothing was done. Now, as the person in charge of pollution control and sanitation, what is the state government doing to ensure that they get the collaborative efforts of local government as well, to ensure that this is not just done by the state government, that local government also do their duty as well and at their own level, where especially in cases where we have dunghills like this in communities?
Thank you, sir. Like you have rightly said, state government cannot do everything. We need the collaborative effort of every one of us to be able to cope this situation. Waste management is a very it's an issue even in Ondo State, that everybody must be ready to key into what we can do and bring it to bring our environment and make our environment to be clean from this waste we're talking of. There are some, like you have rightly said, there are dunghill that has been there for ancient 20-30 years ago, and the state government has about 2-3 years ago we start removing some, yes, within the
capital,
within the local government headquarters. So we've been doing that, but the local government is very important in this issue, because the local government is even supposed to be in charge of waste management. They are supposed to do a lot of things, not only
but it seems like they are not doing that
not only monitoring the environment, but making sure that people get the waste to the right place,
especially in market as well.
Take for example, in our local government, there is dump site there, but there are no agent to collect this waste to that dump site. So it is an issue that we have to bring the attention of local government. As a matter of fact, they are aware of this, but let me say that funding every time has been the complaint. Funding, but notwithstanding, community effort can also be engaged. If you know that waste can cause a lot of evil effect, negative effect to your life, to your health, we can do something to remove it from our own environment. If it is not in my around my house, if it is not in your environment, then there will be no waste everywhere. Everybody should find something to do to make sure that waste is not living with us. We can't hit waste. We have to take it to where it's supposed to be.
Can we have a system like in other developed climes? I know it's done in Lagos, where we have trucks that people pay for. They collect waste from people's houses. Can that be done effectively in Ondo State beyond Akure?
Yes, we have started in Akure. We have a lot of PSP in Akure. Well, it can also be.
Can you get a buying in of local government authorities in extending this beyond Akure?
Well, it depends, because most of our local government, like I've rightly said, talking about funding. Well, most often they know that if they can employ PSP within their own local government, then it will work effectively. It will work very well in those local government. If they have PSP there, if the local government can engage PSP within their locality, then that will go a long way, removing the waste within the local government, and we know with time the whole place will be clean.
Now, Dr. Fagbemi, beyond radio and TV, not everybody listens to radio, not everybody watches TV. In some communities, all they do is some don't even have electricity to watch TV or to get to listen to radio. Beyond radio and TV, do you have a team that goes around the state to educate the people? And then again, the second part of my question, that when you start grooming people from a very tender age, you can change a lot of attitude in the community. Are you also working with schools to talk to school children as well about hygiene, about sanitation, about some of those things?
The Lassa fever control strategies is very comprehensive and well coordinated. In fact, we are now adopting, for some years now, the National Center for Disease Control has done a lot of work, with the states. We now adopt what we call the Emergency Operating Center method, So we use a very coordinated approach. And using that approach, we work with all the structures are available, both at the primary healthcare system, both at the secondary healthcare system. And within the primary healthcare and the local government structures, we have the people we call social mobilizers, community engagers. And one of the things we try to do is to make sure that these people go down to the community, because this is a battle. It cannot be top-bottom approach. People are living in communities. This is a way
in rural
areas. So we do a lot of engagement, talking to them in their languages, sitting them down. Traditional leaders, religious leaders, from churches to mosques, even to community gatherings, enlightening them about what this is. There's a local name for it, there's a Yoruba name for Lassa fever, Ibaorere. So talking to them about it, because you cannot achieve success without attitudinal change and buy-in of the community. So we've been doing that, knocking down doors, door to door. We have door-to-door campaigns, talking about some of these issues.
Do you also engage traditional rulers, religious leaders? Because people tend to listen to their religious leaders, they listen to their pastors, they listen to their monarchs.
We had to engage traditional, of course. Within the health and the environment, we can't work. We have our own culture. There is what we call community entry. You can't just go to a community and start anything. When it comes to community work, you need to get in through the gatekeepers. So first of all, we had to meet with the traditional rulers to tell them these are methods, these are purpose. In fact, they are the ones that help us to coordinate, to bring the people together, to give legitimacy to our method. Because if they don't endorse it, we are there's no way forward. So we try to do that, and we try to let the community themselves realize that, like the Yoruba say, "Tidi babaje." I mean, all these mortalities we are talking about, they are families, they are individuals, you know. So
they're not just statistics; they are real human beings.
Yeah, thank you. So we have to let them realize that this is a battle that everybody must come on board. And we are trying. Where we have gaps, we try to find, just like you have been discussing the issue of waste, letting them have community-driven initiatives, you know, solving some traditional rulers have even volunteered to give us spaces where waste can be, disposal site and things like that. But number one, it's a battle between us and the elements. You know, and the rats are there. They precede us in evolution. They are more than us in number. They breed a lot. They are survivors. They are very smart, way smart. And so we need to get our acts together. There are other issues also. We are also encroaching into their space. People are building as the towns and cities are growing. People are encroaching far into the forest. And where we have challenges of urban planning, you know, people build more. Even nowadays, people live actually right in the jungle.
Yes.
Everybody can just clear a piece of land, and and that's why we are having all these diseases. Some of these viruses that live in animals are now coming to man because we are interfacing with them more. So we need to explain some of these things, you know, why it is not safe for you to just go and clear a piece of land in the bush and be living there. You never know what you catch later. But we know the economic challenges that we are also facing. So all these things we try to explain to them to make sure they come on board. We also try to develop our health system. Again, a lot has been said about health-seeking behavior. Yeah, it is also important that government must make the supply for the services must be available, and from their own end, they must make the demand. And to change our orientation, you see, we are so fatalistic about health. Everything is spiritual. People, and you understand.
Back to sender every hour.
Back to sender. So your understanding of a disease will determine how you manage it.
Yeah.
And that's why, and it's unfortunate. Ondo State has been very lucky for years now. Up till today, the treatment is free. It's free.
And I heard cost government around 1.6 million per person.
That is for those who have. That's on in the other
serious
extreme,
cases.
yes.
Yeah,
because one of the complications is organ failure, and for some of them they have to be dialyzed. They have to be given multiple pints of blood, all at government expenses, and donors.
And dialysis costs a lot.
But you can imagine, and people are not coming forward on time. Of course, there are issues around stigma and all that, which we also address when we talk to the community. There's no reason to be afraid. There's no reason to run away from somebody who has been treated. There's no reason to some even think that they are getting it from the hospital. That is not true. That is the hospital that is forcing the disease on them. We try to clear all these myths, you know.
Now, if you look at marketplaces, that's another issue. When you walk into market, you see the way they manage their way. Sometimes it's not encouraging. Do you also work with market women?
Yeah, we work with market women. I mean, the director of sanitation will tell you a lot of work we are trying to do.
Maybe we should let him answer that.
But let me just say that all of us must work together. If you look at our market, I had prayed and hoped that with this COVID and all the things we've learned, we also need to restructure our markets. The truth is that many of our markets are just not there.
They're not properly structured.
Yeah, and once a place is not properly structured, waste management is going to be an issue. People just have stalls anywhere they like. And
sometimes they clog up drainages and all of that.
It makes the collectors, it makes it even difficult for the collectors. For you to collect waste, you must have access to where it is being generated. Once there are no access, some people just sell on the road anywhere. So we need to sit down together, you know, and redesign the way our markets are, our stores, our shops are, you know, and then put in all these things in place. Of course, we talk with the market women, but I mean, the director, they deploy people.
Mr. Banner.
Yes, sir. like he has almost said a lot of things about it. Waste market generate the most high level of waste. We all know that all over the world. Yes, one of the strategy to be able to collect this waste efficiently is to restructure our market, like he has said, because you want to collect waste from the market. There is no road into it
to drive into the market
to collect this waste. It's a problem. And if it is well restructured, that each store we can access each stores and collect this waste at the time it's being generated along a route. This waste will not be coming together at the same time. You know, most often in our market, you find out that after the market day, they will collect their waste and take it outside and put it somewhere and become a heap of waste. For this heap of waste to be collected, it's a lot of things, because the waste collector, the waste collector will have to spend more. At the end of the day, you won't identify those that owns the waste. Payment becomes difficult. So these are issues. It must be restructured in such a way that we can identify your waste, pay for the waste. What you are paying for it will be used for the for further treatment of this waste and disposal. This is how it's supposed to be. But even, for example, in Akure here, passing through Adeshida Road in the market there, you find a lot of waste, even at the median. When the government has said that don't take your waste into the median, they will put it on the median there, which is very wrong. And the street traders could not even help the issue. See, they just come in the evening. If you pass through that place in the evening, the street trader, you find them even along the road selling. At the end of the day, they will live there and leave the waste there. Whose responsibility is that? Okay. You see, these are issues that if effective management of waste in the market must be done, we have to look at all these issues.
Dr. Fagbemi, let's do a bit of Yoruba because of our people who do not understand English language. Ẹ̀yin ará ilé tẹ́ ń gbọ́ wa, àti sọ̀rọ̀ pa ìbà lassa èyí tí ẹ mọ̀ sí ìbà ọ̀rẹ̀rẹ̀. Ìjọba ìpínlẹ̀ Ondo wọ́n fẹ́ gbé ètò kan kalẹ̀ lórí ìbà yìí. Dókítà Fagbemi, ẹ jẹ́ kí n bi ìgbà wo ni ètò yìí máa bẹ̀rẹ̀ àti pé nípa kí ni ètò ìdálé lórí?
Ẹ ṣe fún àwọn èèyàn wa tó ń gbọ́ wa nílé. Ibà ọ̀rẹ̀rẹ̀, ibà lassa ó jẹ wá lógún ní Ondo State, torí pé ó dàbí ẹni pé tá a bá ń wo àkọọ́lẹ̀ báyìí, ọ̀dọ̀ wa ló fẹ́ fì sí jù ní gbogbo ìpínlẹ̀ tó wà ní orílẹ̀-èdè yìí. A dẹ̀ fẹ́ máa gbégbá orókè ní nǹkan tí ò dáa. Ìjọba wa sọ wípé látọdún yìí lọ á fòpin sí gbogbo orú nǹkan bẹ́ẹ̀ yẹn. Èkútélé ló dẹ̀ ń kó àìsàn yìí wọ ara ènìyàn. Ara èkútélé ni, tèkútélé bá ti ṣègbọ̀nsẹ̀ sóúnjẹ àbí tó bá tọ̀ sí òun ló máa ń jẹ́ kí kòkòrò kó dé ara wa. Àwa ti rí i pé aláti gbógun ti èkútélé ní gbogbo ibi, ní pàtàkì àwọn ìjọba ìbílẹ̀ tó jẹ́ pé àìsàn yìí pọ̀ sí. Lọ́la a máa fi ètò yìí lọ́lẹ̀. Kí la dé máa fi lọ́lẹ̀?
Nílùú Àkúrẹ́.
Nílùú Ọ̀wọ̀. Ìlú Ọ̀wọ̀. Ìdí ẹ̀ tí a fi fẹ́ bẹ̀rẹ̀ nílùú Ọ̀wọ̀ ni pé tá bá ń gbà tá gbogbo ìjọba ìbílẹ̀ tí a ti ní àwọn tí ó ní ibà lassa, Ọ̀wọ̀ ló pọ̀ sí jù. Ó dẹ̀ ká gbogbo ìjọba alára pé a bẹ̀rẹ̀, ṣùgbọ́n kì í ṣe Ọ̀wọ̀ nìkan láti máa ṣe. A máa ṣe ní Ọ̀wọ̀, a máa ṣe ní Ọ̀wọ̀ local government, Ọ̀sẹ̀ local government, Àkúrẹ́ north, Àkúrẹ́ south, Àkókó south west, Àkókó south east àti Ondo local government. Gbogbo àwọn ìjọba ìbílẹ̀ tá ti máa ṣe nìwọ̀nyẹn. Ohun tá a dẹ̀ fẹ́ ṣe ni wípé ìjọba ti ra oògùn pékúpékú àti àtà máa pín fún àwọn aráàlú ní kálukú à ń mú lọlé.
Ẹ̀ẹ́dẹ̀kan ọmọ wọn ṣe ń lò.
Àkọ́ wọn bọ́n ṣe máa lò ó. Ṣé àwọn pé oògùn eku ó léwu, ó ní àwọn ewu tí ẹ̀ta kàn fi sílẹ̀, tó bá ti sọ sílẹ̀ báyìí, eku tó bá ti jẹ́ kì í ṣe gbogbo èèyàn ní ẹni tó bá ní ológbò sílé kò gbúdọ̀ lò. Ẹni tó bá ní adìẹ tó ń jẹ wọnú ilé kò gbúdọ̀ lò, torí tádìẹ bá jẹ òun náà lè kú. Ṣùgbọ́n àwọn tó bá rí pé kò sí gbogbo èèyàn, á sọ fún wọn, wọ́n á díwò lé wọn, wọ́n á fi sílẹ̀. Ẹni tó bá dẹ̀ lọ́mọ kékeré tó ń fà tó ń rákò tó jẹ́ kó lè lọ, a máa ṣe gbogbo àlàyé yẹn wọ́n ṣe máa fi sílẹ̀ tó bá dẹ̀ fi sílẹ̀ tẹ́kù yẹn bá ti kú wọ́n á mú wọn fọwọ́ lásán mú wọ́n á fi ọwọ́ wọ́n á kọwọ́ sínú ọ̀rá wọ́n á fi mú eku yẹn. wọ́n wà á mú
tó bá ní bọ̀wọ́ bíi gloves.
àbẹ́ tó bá ní ìbọ̀wọ́ wọ́n á fi mú eku yẹn tó bá ti wá mú eku yẹn wọ́n á fi sínú ọ̀rá wọ́n wá mú wá sí ojúkò kọ̀ọ̀kan wọ́ọ̀dì kọ̀ọ̀kan la máa fa àwọn èèyàn sí
political wọ́ọ̀dì kọ̀ọ̀kan. rí a gbọ́ pé ẹ fẹ́ máa ra eku lọ́wọ́ ẹ máa sanwó fún àwọn èèyàn.
a máa sanwó eku tó bá ti pe eku báyìí tó bá ti mékun wá owó ni kì í ṣọ̀fẹ́ eku kọ̀ọ̀kan tó bá pa olóye tó máa fi rà tíjọba máa rà kó wá tó di pé àwa lọ dáná sùn á bò mọ́lẹ̀ nǹkan tá a fẹ́ ṣe nìyẹn a fẹ́ ṣe tó jẹ́ pé nígbà tá a bá máa ṣe tán gan-an kò tí ẹ ní kófìrí eku ní sàkání wa àti gbogbo àwọn àlàyé tá a máa ṣe nípa bí a ṣe máa ṣètò ìmọ́tótó nínú ilé wa a máa bẹ̀rẹ̀ lọ́la tá a bá ti bẹ̀rẹ̀ lọ́la báyìí a máa ṣàlàyé ibi táwọn èèyàn máa ní wọ́ọ̀dì kọ̀ọ̀kan kì í ṣe pé ẹ máa rìnrìn àjò ní wọ́ọ̀dì kọ̀ọ̀kan tẹ́ wà wọ́ọ̀dì yín báyìí ẹ kàn rìn lọ́bẹ̀ ẹ fún eku tẹ́ pa sílẹ̀ ẹ dẹ̀ gbowó yín ó tán ẹ padà lọlé.
ó dáná ẹ mẹ́nu bà àkọ́kọ́ lẹ́ẹ̀kan ẹni bá ní ẹdìẹ tó ń wọnú ilé nǹkan kan wá sí mi lọ́kàn ẹni tí sẹ́wọ̀n láwọn ilé ibòmíì wọ́n níbi tí wọ́n ń da àdọ̀tí sí tí eku máa ń ṣeré wá tẹ́dìyẹ náà ń lọ bẹ̀ ṣẹ́dìyẹ ò lè ká àìsàn wọnú ilé.
ṣe rí ó ti ẹnì kejì mi ti sọ̀rọ̀ lẹ́ẹ̀kan pé aláti yí ìwà wa padà ṣe mọ̀ yí pé ohun ìtìjú gan ni.
sórí ilé ìbomi ẹ̀dì á máa gorí chair bọ́ sórí àga bọ́ sórí tábìlì.
ara àwọn ìwà tó ń tì wá lójú tá a ṣe ń kù nìyẹn kò yẹ nǹkan tá à ń sọ ìwọ̀n gbọ́dọ̀ máa sọ níbi tí tó làjú ti wà pé èèyàn gbé nínú ilé òun àtàdìẹ jọ ń gbé nínú ilé ṣùgbọ́n báwọn yẹn wá ṣe ó dìgbà tá a bá yí gbogbo àwọn ìwà yẹn padà tá a bá lé kòkòrò àìsàn lásà lọ lónìí àìsàn tó wà lára adìẹ tó lè kó sára ènìyàn kọ́ ṣùgbọ́n tá a bá ń ṣàlàyé àwọn èèyàn rò pé bóyá a fẹ́ máa ṣòfin tó ní pé bá a ṣe ń ṣe láti lè wà kò dáa kí ènìyàn àti àwọn ẹranko yìí jọ máa gbé pọ̀ ó lẹ téèyàn bá fẹ́ sin adìẹ ṣe ló yẹ kó níbi tí ó ti sìn ṣùgbọ́n ara àwọn ilé tó jẹ́ pé adìẹ jẹ́ wọlé adìẹ ń jẹ́ wọ ibi tó ń gbóúnjẹ sí torí láti dáàbò bò wọ́n la ṣe ń sọ pé tó bá nírú bẹ́ẹ̀ kì í ṣèwà tó dáa rárá yàtọ̀ sí eléyìí àwọn àkìtàn wa a fẹ́ fi àwọn oògùn eku wọ̀nyí náà síbẹ̀ láti rí i pé a pa àwọn eku yẹn aláti pa àwọn.
ó dáa náà nígbà tí ètò ìbá bẹ̀rẹ̀ káàkiri àwọn ìjọba àbílẹ̀ ibi tẹ́tí mẹ́nuba àwọn orí kò gbò ní kí àwọn èèyàn ti wá máa pàdé yín láti gba oògùn eku wọ̀nyí.
ohun tá a ṣe ni pé kó bá rọ̀ wá lọ́rùn ní ìpínlẹ̀ Ondo aṣoríire kò sí wọ́ọ̀dì kankan political ward kò sí wọ́ọ̀dì kankan tí a ní health center sí kò sí so ohun tá a fẹ́ ṣe ni wípé torí àwọn health center táwọn èèyàn ti mọ̀ kì í ṣe pé ká ṣẹ̀ṣẹ̀ tó máa dárúkọ ibì kan tó ṣàjèjì sí wọn a ti fún wọn ní ka orúkọ ibi tí àwọn health center kan tó wà ní wọ́ọ̀dì tó máa wà tí àwọn èèyàn á lọ tí wọ́n lọ tó bá ṣàtìpa ẹ̀kọ́ ẹ̀ dì sínú nylon bó ṣe 6 bó ṣe 12 ló pa oògùn tá a fẹ́ lò yìí gan àwa náà ti dán wò ká tó ti pa ààrẹ tó ti pa 5, 6, 10 nínú ilé rẹ̀ oògùn tó múnádóko ni so wàá ṣà sínú nylon bó bá ṣe pa sí bẹ́ẹ̀ ni owó rẹ̀ ṣe máa pọ̀ sí ìrẹ́jọ sí fọ́tò.
ó dáná ńgbà tẹ́ ń sọ̀rọ̀ lẹ́ẹ̀kan ẹ mẹ́nuba àwọn ìjọba àbílẹ̀ bíi Ọ̀wọ̀ Ọ̀sẹ́ Àkúrẹ́ North Àkúrẹ́ South ẹ mẹ́nuba Àkókó South West àti Àkókó South East ẹ mẹ́nuba ìjọba àbílẹ̀ Ondo West ṣùgbọ́n àwọn ìjọba àbílẹ̀ kan wà tí a gbọ́ pé àrùn iná ibà ọ̀rẹ́rẹ́ wà tí ẹ mẹ́nuba bí ilẹ̀ Olújí Òkè Igbó bí Ìdànrè bí Ìfẹ́dọ̀rẹ́ la wà nítorí ìlàámọ̀kì ni Àdàbà FM wà bí Ìfẹ́dọ̀rẹ́ kí ló dé tí ètò yóò dé àwọn ibi tí.
Ìfẹ́dọ̀rẹ́ náà wà lára ẹ̀ nǹkan tó ṣẹlẹ̀ ni pé à ń wo ní ìpele àkọ́kọ́ tá a pè ní phase 1 torí pé àwọn kan náà ló ṣe kò kárí ètò yìí káàkiri gbogbo ìpínlẹ̀ yìí tí a bá dẹ̀ tíṣẹ́ yẹn bá pọ̀ jù à ní lè mójútó so tá a bá kọ́kọ́ wọ́n ní ká kọ́kọ́ bẹ̀rẹ̀ níbi tí tó jẹ́ ojúkò àsàn yìí gan nígbà tá a bá ti ṣe yẹn tí a ti fi gbogbo ètò yìí sílẹ̀ tó dẹ̀ ń lọ a wà pọ̀ sí àwọn ìjọba ìpínlẹ̀ ìpín tó jẹ́ pé wọ́n ní kì í ṣe pé kò ní àìsàn ṣùgbọ́n kò pọ̀ àwọn yẹn la máa fi kásẹ̀ ńlẹ̀ ṣùgbọ́n ká kọ́kọ́ bẹ̀rẹ̀ níbi tí ogun ti le gan-an.
ó dáná fún ẹ̀yin èèyàn wa tí ẹ bá fẹ́ pè wọlé láti bá àwọn èèyàn wa tí wọ́n wà ní ní yàrá agbára wa ní àtẹ́fẹ́ bá wọn sọ̀rọ̀ àti ẹ̀ ní ìbéèrè tẹ́fẹ́ béèrè lórí ibà lassa yìí èyí tí a mọ̀ sí ibà rẹ̀rẹ̀ nọ́mbà tí ẹ máa fi pè wá ní 09081778793 09081778793 tàbí kí ẹ pè wá sí 08162519991 08162519991. For those who do not understand Yoruba, if you have any questions for the head care practitioners in the studio, the numbers to call 09081778793 09081778793, or you call 08162519991 08162519991. Hello.
Good afternoon, sir.
Good afternoon.
Hello, sir.
Hello, good afternoon. Please, your name and where you call.
Spoke in Yoruba.
Okay, please go ahead. Kí lorúkọ yín bọ́lẹ̀ tí ń pè wá?
Ìkàdí mo fẹ́ bẹ̀rẹ̀ ni pé eku yẹn Àdìgún náà kò láti mi fún.
Kí lorúkọ yín bọ́lẹ̀ tí ń pè?
Àdìgún láti mi fún. Hello.
Hello, à ń gbọ́ yín.
Ìkàdí mo fẹ́ bẹ̀rẹ̀ ni pé eku tán ní ká máa pa yẹn ká máa mú wá sí oríkò yẹn kí ni eku yẹn kí náà fẹ́ fi ṣe.
Mr. Àdìgún ẹ ṣe kò sí nǹkan tá a fẹ́ fi ṣe a máa pa wọ́n ni a fìná sun wọ́n a dẹ̀ eérú rẹ̀ a bò mọ́lẹ̀ nǹkan tá a fẹ́ fi a kàn fẹ́ rí i pé a encourage àwọn èèyàn láti pa àti láti kó wa ni kò sóhun tá a fẹ́ fi ṣe ṣùgbọ́n a yẹ̀ wò torí kì í ṣe gbogbo àwọn ó ní àwọn oríṣi eku kan pàtó tó máa ń fa ibà lassa yìí ó ní àwọn eku kan tó jẹ́ ọlọ́yàn tó pọ̀ àwa gan tá a bá ti gbà á lọ́wọ́ àwọn aráàlú á kọ́kọ́ yẹ̀ wò á wo irú àwọn eku yẹn tó pọ̀ nínú á wo bó ṣe pọ̀ sí ní àwọn eku tó wà láyìíká wa ṣùgbọ́n àwọn ọ̀jọ̀gbọ́n tó mọ̀ nípa ẹ̀ ló máa yẹ̀ wò ara àwọn nǹkan tá a máa kọ́kọ́ díẹ̀ tá a ṣe fẹ́ gbà lọ́wọ́ àwọn aráàlú nìyà á kọ́kọ́ yẹ̀ wò pé òkè irú eku yìí ọlọ́yàn púpọ̀ ó wà lára ẹ̀ ìyókù náà ṣùgbọ́n kò séku tá a pa náà tá a ní sanwó fún o ṣùgbọ́n láti mọ oye tó jẹ́ tí a dé ọ̀rọ̀ yìí símọ́ lórí jù gan á mọ iye ẹ̀ lára eku tá a bá pa.
ó dà náà 09081778793 08162519991. Hello.
Ìbéèrè mi kejì ni wípé ògùn tán máa pín fún àwọn local government yẹn báwo ló ṣe máa dé Òdìgbò local government.
Òdìgbò local government tá a bá parí ìpele àkọ́kọ́ ní ìpele àkọ́kọ́ kò tí ì sí Òdìgbò ń bẹ̀ ṣùgbọ́n ní ìgbà tá a bá wá sódìgbò a máa wá sọ́dọ̀ yín kì í ṣe pé ẹ̀yin lẹ máa wá a wá sódìgbò local government wọ́ọ̀dì kọ̀ọ̀kan ní local government yẹn làwọn òṣìṣẹ́ elétò ìlera àti elétò ìtọ́jú àyíká ló máa wà àti àwọn òṣìṣẹ́ even àti agric so kò ń ṣe pé ẹ máa rìn jìnnà ní each ward làwọn èèyàn wá máa wà wọ́n á dẹ̀ ti ṣàlàyé wọ́n á ti polongo wọ́n á ti laago káàkiri ẹ ti mọ health center tó wà ní ward yẹn tí ẹ ti máa wá tí wọ́n ti pín.
ó dà náà hello.
Yeah, good morning.
Good morning. Please, your name and where you calling from?
Olaolu from Makunga.
Olaolu from Makunga. Please go ahead with your question.
Yes, the point is that this waste disposal issue in some states. We saw it in television. This Ebonyi State man, he did a wonderful thing. He has machine for crushing this thing and to turn.
Hello. Maybe the network is not so good on his own end, but I think it made his point. He said in Ebonyi, what is being done is different from what is being done in Ondo State. That the government has a machine that is used to crush these rats.
No, he's talking about machine waste compactors to crush.
To crush the waste. Okay.
Yes, of course there are waste compactors machine in Ondo State, and maybe he's also talking about recycling. Recycling is at the last end. We are starting with even collection. What happens to the waste when it gets to the final disposal is another issue. But let's even collect it. Our problem now is that the waste are in the homes and then they are in the surroundings. So first strategy is let's get it out of your home. let's get it out of our immediate environment. When we are able to collect it efficiently, regularly, then we can now invite people to say, okay, we are collecting all these things regularly, it's coming regularly. Can you turn it to manure? Can you turn it to this? Can you turn it to that? But if we are not even collecting at all, it's difficult. So the first strategy is let's collect it regularly, daily. And we know how many we are even collecting. Because any company that is coming now, we want to know the volume of waste we are generating. And we cannot be guessing. But if we are collecting it, and we know we are collecting it every day, the company knows that we are talking about 100 tons, 200 tons, and that is the way to go forward.
Okay, hello. Hello.
Ẹ káàárọ̀ sà.
Ẹ káàárọ̀, kí lorúkọ yín bọ́lẹ̀ sí pé wá o.
Orúkọ mi ni Wòlíì David Solomon.
Wòlíì David Solomon, à ń gbọ́ yín o.
Ẹ̀mí bẹ láti ìlú Ọ̀kà Àkókò.
À ń gbọ́ yín.
Mo kí n pé ẹ kú ètò bàbá mi.
Ẹ ṣègùn.
Ọlọ́run á wà pẹ̀lú yín.
Àtẹ̀yìn náà.
Mo fẹ́ béèrè bìrì kan pé àwọn eku kan tó máa pè ní eku ẹmọ́ yẹn, ṣé àwọn ọmọ kéékèèké máa pa wọ́n yẹn? Ṣé èèyàn lè pa?
Ẹni eku.
Okay.
Ẹ ṣáà ti pa eku, ẹ mú wá. Ẹ bá ti mú dé.
Àwọn èkìtì wọ́n máa ń pa káàkiri wọn ní kábìrì. Kó bá dà pé bí kí a lè mẹ́ tó jẹ́ náà.
Ẹ máa ṣàlàyé tó bá pa, kó má fi ọwọ́ lásán mú, wọ́n á fi ọ̀rá mú, wọ́n á dẹ̀ mú sínú ọ̀rá. Ẹ bá ti mú dé ojúkò, wọ́n fún yín lówó eku.
08162519991. Hello. 09817778793. These are the numbers to call. 08162519991. Do you have any questions about Lassa fever? Hello. Okay. While we're waiting for okay, I think there's another caller there. Hello, good morning. Hello. Okay. Dr. Fagbemi, I don't want us to go without touching on these. I know that even in healthcare settings, that person-to-person transmission is also okay. I think we have. Hello.
Hello, good morning.
Good morning. Please, your name and where you're calling from.
This is Safa Abbas from Ebotaku.
Okay. Please go ahead with your question.
This Lassa fever we are talking about can't just be cured. Can it be cured once and for all?
Oh.
After being cured, can person can still get it communicated again? I just want to know.
Well, we are not talking of cure once and for all. There are drugs that are used to manage it, and the drugs are working fine. People that are sick, if they come to hospital on time, they will be cured and they will go back home. But that does not mean that if you go and eat infected garri again, you can catch it again. So, because it's like any disease, you have to continue to maintain your personal hygiene. But the important thing is, if you are sick, go to the hospital. If it's Lassa, you'll be treated on time. But if you come late and the organs of the patient is already damaged, then there may be little that can be done for such a person.
Mẹ́nu bà gàrí, àwọn èèyàn wá sì ń jẹ gàrí dáadáa. Ọ̀pọ̀lọpọ̀ àwọn èèyàn tó ń ta gàrí ní òun fi nǹkan kan bò. Ọ̀pọ̀lọpọ̀ bí wọ́n bá tún gbé wọlé nírọ̀lẹ́, kò sí pé wọ́n fi nǹkan kan bò. Tí wọ́n bá sì lékun sílé eku àti mẹ́nu bà gàrí, wọ́n á sì gbé padà sọ́jà lọ́jọ́ kejì. Ọ̀pọ̀lọpọ̀ á sì ra ẹni tó bá tiẹ̀ fi tẹ̀bà, ṣebí tiẹ̀ yá, ó ti dà sínú gbóná. Ẹni tó dà sómi tó fomi tútù mú lásán kọ́.
A ti sọ àwọn arákùnrin mi wọ́n ti bá wọn sọ̀rọ̀ nípa ọ̀rọ̀ ní gàrí. Àwọn tó ń ṣe tẹ́lẹ̀tẹ́lẹ̀ ṣe ló yẹ kán yan ọgbẹ, ṣùgbọ́n àwọn èèyàn míì gan ò ní yan ọgbẹ, wọ́n máa sa sílẹ̀ torí kí owó tí wọ́n pa lórí ẹ̀ bá lè pọ̀. A ti ń bá wọn ṣèpàdé gbogbo ọgbọ́n a dùn máa gbà wọ́n níyànjú náà ni. Ṣùgbọ́n a dẹ̀ ń rọ àwọn èèyàn wa pé tán bá máa ra gàrí kán wo ẹni tí wọ́n ra gàrí lọ́wọ́ ẹ̀. Ó láwọn ibi tí wọ́n ti ń ṣe gàrí dáadáa. Kò sí ìlú tí ò níbi táwọn èèyàn ti ń ṣe gàrí tó dáa tí àwọn èèyàn wá lè máa ti lọ rà á. A máa pàrọwà sí wọn náà ni. A dẹ̀ máa bẹ̀ wọ́n wò lóòrèkóòrè títí ìgbà tí gbogbo ìwà yóò fi yí padà.
Ọ̀rẹ́ náà. Hello. Ẹ káàárọ̀. Kí lorúkọ yín bọ́lẹ̀ tí ń pè wá o?
Láni àti Ondo State.
Níbo l'Ondo State? Ondo State yìí tóbi.
Ní Ògógó ní Waterside local government.
Okay, water side ló wọ̀ nípínlẹ̀ Ondo. Okay, béèrè question yín.
Nǹkan tí mo fẹ́ béèrè ni pé ibi tí mo wà eku pọ̀ gan mo dẹ̀ lè fi àwọn dárámọ̀ tó kó eku wá gan but tí n bá pa wọ́n níbo ni mo fẹ́ kó wá gangan.
Ẹ ní sùúrù díẹ̀ tí a bá ti parí àwọn ìpele àkọ́kọ́ àwọn local government bíi 8 tá a ti fẹ́ ṣe ìpele àkọ́kọ́ nígbà tó bá yá a dé ti ìlàjẹ local government tá a bá ti dé ọ̀dọ̀ yín a ṣàlàyé ibi tí ojúkò máa wà ní wọ́ọ̀dù yín kì í ẹ̀ tiẹ̀ ní láti lọ sí local government headquarter ní wọ́ọ̀dù yín ẹsẹ̀ tàkọ́ máa wà níbẹ̀ tá a máa fi ojúkò sí tẹ́ máa kó eku wá sí.
Ó dáná ìlú Ọ̀wọ̀ ni ó dàbí oríkò ibi tí ẹ ti ń tọ́jú àwọn ènìyàn torí nínú ìfọ̀rọ̀wérọ̀ tí Premium Times ṣe fún yín ní March ìyẹn oṣù kẹta ọdún tí mo kà ní ìlú Ọ̀wọ̀ ló dàbí ibi oríkò tí wọ́n ti ń ṣe ìtọ́jú àìsàn yìí fún ẹni tó wà nírú Ìlàjẹ ẹni tó wà lódìgbò ẹni tó wà ní àkókò tí ẹ̀sùn mọ́wọ́ ẹni tó wà níbi tó jìnnà sọ́wọ́ tí wọ́n sì lárùn yìí wọ́n fẹ́ wá sí hospital lóòótọ́ ṣùgbọ́n ó yá kò sówó lọ́wọ́ wọn kí ni ìjọ ní o tíjọba lè ṣe fún wọn.
Ìjọba tẹ̀ ti ṣètò tó dáa lórí ìyẹn anywhere tí a bá ti ní patient àti gbé patient látòkè tí pópá àti jù bẹ́ẹ̀ lọ ohun tí patient yẹn ní láti ṣe ni pé tára ẹ̀ ò bá ti yá lọ sí hospital ní kété tí àwọn elétò ìlera bá ti rò pé ó lè jẹ́ lassa ni ẹni yìí ní ìjọba ìpínlẹ̀ ó ti take over.
ambulance ti débẹ̀ wọ́n ti gbé wọn.
wọ́n gbé bó tiẹ̀ ṣe private hospital gan bó ṣe ìjọba bó ṣe ilé hospital aládàáni tó bá ti pè wá torí wọ́n máa ń pè wá pé ohun táwọn rí yìí o ó fẹ́ jọ báyìí o kíákíá àwa fúnra wa ti ṣètò bó ṣe máa dé oríkò ìtọ́jú.
Okay, let me ask Dr. Bwelila. Now, in healthcare settings, just as I was saying the other time, you know that person-to-person transmission is also common, especially maybe you don't have PPE, personal protection equipment, or maybe they are not enough or they are not used. Are you ensuring that healthcare workers do not contract this fever that we're talking about?
Thank you very much. Let me also stress the fact that as the government is emphasizing talking to the community, the healthcare sector is also being effectively taken care of. And how do I mean? Series of training and retraining is currently going on for the healthcare workers in the state. And what they need to know, vis-a-vis the issue of lassa fever, what they need to look out for, the question needed to be asked, and having a very high index of suspicion is very, very important among the healthcare workers. And like we're also telling people, personal hygiene is also very important, most especially now that the issue of COVID and the second wave of COVID is already in existence. People have to continue to be told that the regular hand washing is important, and you must be able to protect yourself and ensure that you don't contract anything from patient, and at the same time you don't transfer infection to your patient. So these are recurrent things that is going on regularly in all the hospitals. And like I also said before, we've also mapped out another strategy going around these hospitals one after the other.
Including private hospitals?
Including private hospitals, pulling them together and having them trained what they should look out for, what they need to do to protect themselves, and also ensure that their patients are protected.
Thank you very much. Maybe just one more call before we call it today. Hello? Hello? Okay. Okay. Hello?
Hello?
Hello? Good morning.
Good morning.
Good morning. Please, what's your name and where are you calling from?
Akeredolu from Akure.
Okay, Deolu, go ahead, please.
Please, I want to ask, how long can this virus stay on the surface before it dies?
Okay. That's a good question.
It's very difficult to say, but some people researchers have said that it can stay up to 3 days. You know, some within some hours or as much as it depends. You know, when you talk about a virus staying outside, you talk about the kind of surface you are talking about. Is it a wet surface? Are there liquids? Are there things on it? There are some medium that promotes the existence and prolong the
Especially when the place is moist.
That's the weather, the temperature, all those things are very important. So what we advocate is that when you get to your kitchen in the morning, clean your surfaces, make sure it's tidy. Just make sure you wipe everywhere clean and maintain a personal hygiene. That way you'll be safe.
Okay, thank you very much, Dr. Fagbemi, State Epidemiologist in Ondo State. Thank you very much for coming on today's edition of Akeredolu Working. I want to thank Mr. Banoye, the Director, Pollution Control and Sanitation. Thank you very much for coming. And Dr. Biliola, thank you very much. Bilila, thank you very much for coming. He's the Assistant Epidemiologist in Ondo State. Thank you very much for coming. My name is Dimitri Ranas, and this is where we draw the curtain on today's edition of Akeredolu Working. Do join us next Thursday for another edition. Thank you.
Adaba FM, adding value to broadcasting.